Namaskar, I am Dr. Anjali Bhatt, practicing endocrinologist in Pune. I passionately care about patients with diabetes, thyroid and other hormonal disorders. And we are going to talk today about a very important gland in the body that is called thyroid gland. Thyroid gland is a small butterfly shaped gland in front of our neck, and it produces, as the name goes, thyroid hormones which are called T3 and T4. Triiodothyronine and tetraiodothyronine. Now these hormones are very important to regulate the metabolism of our body. By metabolism I mean every process that goes on in the body, which includes our eating habits, our bowel habits, the hunger, your sleep, your heart rate, your breath rate, in women the menstruation, the cycles, the date of the cycles, all these are regulated by thyroid hormones. By this I am sure you would have understood how important it is to have normal thyroid functioning in our body. Let's go to the topic of today, that is thyroid levels, the hypos and hypers of it. What does it mean that the thyroid gland is functioning low? We call it hypothyroidism. And if the thyroid gland is functioning in excess, we call it hyperthyroidism. Fortunately, and with the advances of the science, it's very easy to detect any abnormality in thyroid function or the structure of the thyroid gland. Let's go ahead and look at what are the problems to detect in the functioning of the thyroid gland. And in the blood we can easily test these two hormones, that is T3 and T4. If their level is low, we call it hypothyroidism. And if you have hypothyroidism, you will have symptoms of low metabolism or slow metabolism. That is less hunger, excessive weight gain, excessive sleep and delayed menstrual cycles. And when the thyroid hormones are in excess, we call it hyperfunctioning of thyroid gland or hyperthyroidism, and the symptoms are exactly opposite. That is excess hunger, weight loss and excessive heart rate, what we call as palpitations. If you have hypo or hyperthyroidism related symptoms, then it is must to check for thyroid hormones. Sometimes a very minor problems in thyroid gland functioning can be asymptomatic or something that will not give you any symptoms. In such cases also we recommend a routine testing of thyroid function. Now it's practically not possible to ask everyone to get a thyroid function test done, but if you are anyway getting a routine checkup done, it is very important to remember to add a thyroid function in your checkup. Now let's go and see what all we test in the blood when we are testing for functioning of the thyroid gland. We saw that we test T3 and T4. There is another very important hormone that we check, that is called TSH. This is called thyroid stimulating hormone. This is actually produced by pituitary but regulates the production of T3 and T4 from the thyroid gland. Now TSH is a very stable, reliable and sensitive hormone. By that I mean is that TSH values do not change from now and then, and the TSH values are very sensitive to any small change in T3 and T4. So practically if your pituitary gland is normal, a normal TSH would mean that your thyroid function is absolutely normal. So if you are doing a routine test, TSH is the hormone that must be included in the testing. Now coming to the second aspect of thyroid abnormalities, which can be abnormalities in the structure of the gland. So irrespective of what is the hormonal level in your body, your gland size may be large, it may have swellings, it may have something called as cancer. So to detect these, we need to do an ultrasonography of the thyroid gland, that is USG of the thyroid gland. In some borderline cases of hypo or hyperthyroidism, we might need to do specialized blood tests that are called thyroid antibodies. These can be TPO antibodies, thyroid TSH receptor antibodies and thyroglobulin antibodies. These are not the tests for everyone, they may be costly and will be recommended by your doctor only if they are needed. Coming to a last but a very specialized test called as thyroid scan. This is a thyroid nuclear medicine scan and is done in some cases of hyperthyroidism to guide the further treatment. Coming to the summary of today's discussion, we saw that thyroid gland is a small gland in front of your neck which produces very important thyroid hormones. They are essential for our metabolism. If we need to test for normal or abnormal functioning of the thyroid gland, we test for TSH, T3 and T4 in the blood. If we are looking for the structure of the thyroid gland, we do an ultrasonography of the thyroid, and in some rare cases, a doctor might ask you to do specialized tests like antibodies or nuclear scans. I'll be happy to take if there are any queries. With that, we'll stop today. Namaste.